Welcome to the Heart of Giving. As you know, we interview the nonprofits in the city of Long Beach and tell you about the things that they're doing to strengthen our city, show love and support. And just as an aside, I have to tell you that after each taping, I feel so good about the city of Long Beach and the people that want to make our city a better city and take care of each other. So today is no exception. Today I have a group that I'm delighted to have here today because they've done so much for so many years that they need to know, you need to know, all of the wonderful things they've done, and that is the Long Beach Children's Dental Clinic. And we have Dr. John Blake and Barbara Lieberman-Jones with us today to tell us about the background and what this does for our children. Welcome.
Yeah.
Nice to see you.
Thanks for having us.
Yeah,
Really
now
great to see you.
you guys are a team because I've seen you talk together at other occasions, and you have been with it longer. So tell us about the beginning, and then we'll get to exactly what happens every day.
Sure.
Okay.
Sure. Well, we were founded in 1932. Dr. Robert Anderson was at that time private dentist that saw the need in the city and started actually in a room in the Tishner Clinic. And then from there, the earthquake hit, of course, and he wound up in a mobile trailer treating children at the school sites. Mm-hmm. And it developed from there. The Junior League of Long Beach got involved and helped secure some space for us in a bungalow at one of our schools. And then about 1970, we moved over to Miller Children's Long Beach Memorial Medical Center down on the ground floor, where we were until 2005 when they started the construction of the new program there, and we went across the street into our building now. So quite a history.
And it's a permanent place where you are
yes,
now
it is.
at Memorial.
Correct. Yeah, we leased space from them, and we were able to expand, almost double our size when we did move back then. So 81 years. Still
And
going.
have you been? How many years have you been with them, Dr. Blake?
Well, I started as a volunteer. My mom was in the Junior League, and she said, you know, get off the beach and stop surfing and go look at some professions. She said, so I ended up volunteering there. That would have been in 1980. And it was just such a great staff, and I loved what they were doing. The children all seemed happy to be at the dentist, and I thought, well, maybe I'll be a dentist. So that sparked.
Is that right? I didn't know all that.
Yeah, that sparked my interest in dentistry, and at the time, Clara Andrews was the director, and then when I was volunteering, it switched to Patty Acosta, whom you know, and
yes, was there many years.
Administrator for many, many years. But that sparked my interest, and came back when I got out of dental school. Started a private practice, but always had a hand in either at the board level or treating patients when I could, a day a week. And then years later, I ended up selling my private practice to go over full-time. That's been about 10 years now.
Is that right?
Yeah,
so you're full-time at the clinic?
Yes. Mm-hmm.
Oh, that is wonderful. You know, and I hate to bring this up because it was so long ago, but I was a child helped by the Children's Dental Clinic when I was in elementary school, because they had a mobile unit that would come to the schools, and you got a button if you had good teeth. And oh gosh, that was a real tribute. You know, got good teeth. It's wonderful. But anyway, I know the things that you do there, and the heart that I feel when I look at both of you is that you love what you're doing.
That's great.
So either you or Patty, tell us about Barbara.
I mentioned Patty.
Well, you mentioned Patty, and I knew Patty. The depth of what you do every day, and the outreach that you do.
Sure, Barbara.
Well, I have been with the clinic for 7 years, and but I've lived in the greater Long Beach area for 32. And we should all be so proud that the city of Long Beach is home to the Children's Dental Health Clinic. Because what we do for our children, I don't know of any other city who has a safety net nonprofit clinic such as ours in California. Mm-hmm. It's all about the child, and we are there for any child who can't afford dental care. Most of our patients are on Medi-Cal. Around 20 to 30% have complex medical considerations. And what's so special and unique about us is that Dr. Blake has all multi-specialty dentistry under one roof. So a child who comes in and a parent, let's say, has been searching for a dentist and can't find one in our community who takes DentalCal and their child has autism, they know that their child will be taken care of by a specialist in our clinic under whatever type of sedation, level of sedation that's necessary.
Right.
Every program is integrated, and besides the fact that we provide dentistry, we're also a teaching facility. And I think Dr. Blake would like to share a little bit about that uniqueness.
We've grown to, we house the USC pediatric dental residents in their second year.
Oh, is that right?
So,
That's a great connection.
3 of them receive all of their clinical training at our facility in their last year. And we've got associations with their oral maxillofacial surgeons. The Cerritos College hygiene program rotates their hygienists in training through. So we're this little mini dental school and teaching facility in addition to, you know, providing the dental care. And it really, as Barbara mentioned, it goes anywhere from just the basic cleaning and x-rays to taking a child to the hospital operating room that has some complex medical considerations that needs to be treated under general anesthesia. So the whole gamut, it's a true dental home.
Because when it first started, I think it was mainly looking at cavities.
Sure, yeah, it's just very basic drill and fill, if you will. So,
Yeah, it is drill and fill.
Yes.
yeah, a little more than that now.
Yeah.
And knowing in the city of Long Beach, one of the references that we use is how many children in Long Beach schools are on reduced lunch, which means you're 185% of the poverty level. 57,000 out of around 85,000 children are on reduced lunch. This is our population. And we're very proud of the fact that we also have programs for prevention. And right now, Dr. Blake has begun a study to start providing sealants for our children of Long Beach who are underserved.
Providing what?
Dental sealants. You may want to talk.
It's a preventative procedure. Just basically a plastic coating is placed on the chewing surfaces of teeth, and it protects them from future cavities. So the Medi-Cal or DentaCal system will only cover certain teeth, and we felt that all the teeth that were appropriate to seal should be taken care of. So
then.
Barbara was able to secure some grant funding, and we've started a research project, long-term 5-year research project that's through, you know, approved through the hospital to study if we're sealing these teeth, do they get fewer cavities? And the research has shown that they do, but we've got an internal program and we're providing this service for the children of the community. So it's just kind of a nice tie-in.
Well, when you talk about the children of Long Beach and the fact that we have so many children in need that can't afford dental services, and you take care of them, I think is a tribute to all of you. I mean, it's a tribute to the city, it's a tribute to the 2 of you that I know work at this constantly. I know you have fundraisers, dinners, so because I remember being at a few of those. But tell us about how many you deal with, you know, how many you've had through the years. People would like to know, is this a specialist thing and you have to have the right clothes on or anything? I know that you take any child that's in need, and you gave us the slogan that you had.
Well, every organization or nonprofit has their internal value system, that everybody is on the same page of why they get up every day to do what they're doing, the passion that drives them. And our slogan for 81 years has always been that we say to our donors and those who support us, thank you for believing with us that every child deserves to smile.
Yeah.
When the child comes in and they're in pain, and 50% of all of our children in kindergarten have had dental disease, and by 3rd grade it goes to 70%.
Is that right?
That dental disease causes pain. Children can't sleep at night, they may not be eating, and they definitely are not concentrating in school. When that child walks in our door, we want to make sure that they leave
With a smile.
with a smile.
Oh, that's wonderful. And how many do you accommodate each day?
Our overall numbers are 10,000 patients, unique patients, and about 30,000 visits a year. And that's, we're talking on the clinical side. If we get into the outreach and the prevention that we do in the schools, that number is certainly bigger. But we have yet to turn a patient away that we couldn't accommodate with our specialist or our pediatric dentist. And so if someone's in need and they're looking for a resource, that's really what we're built around. We want children to gain healthy smiles.
Well, you know, I just, every time I walk by there, I just see a room full of children, and many of them probably have never been to a dentist, and they're all excited and nervous about, but with the attitude that the both of you have and the number of people that you influence, it makes it a better day. So I thank you so much for being here. What a wonderful tribute to you and to our community. Thanks so much.
Thank you, Marilyn.
Thank you.
And be sure and come back.